Hi, Dr. John Raphael Schneider here. I recently read an article on Neurology Today that talked about physician documentation and how that is a problem. And it really motivated me to create this YouTube video because I've been talking about this for a while, but no one listens. Anyway, the title of this video is The Doctors Stop Writing Long Notes. Okay? And how concise documentation improves care and saves time. The problem with long notes is manifold. Number one, they're time consuming. I, I see a lot of physicians who are having to work long hours into the weekends or late at night because they're writing very long notes. And it causes something called, in that article, they referenced it as note bloat, meaning that the notes become extremely long. And the longer they become, the less likely anyone's actually going to read them. They're very impractical in the real world. The other day, one of my colleagues who was on call got 26 new consults in one day. That's just in one day. And that neurologist, she was on call for 7 days. So the other days were not much better. She was getting 20 plus consults every day. If you're writing long notes, it's going to make your job a lot harder. And not just your notes, not just writing those long notes, but if you're having to read other specialists or other doctors involved in the care who are writing very long notes, that is also very impractical and it's going to make it so it takes longer for you to do your work and harder for you to find the important information. Fellow physicians, they don't like long notes. Think of it, when you're on call and you're having to read other specialty notes, would you rather read a note that takes 3 pages or one that is just a short paragraph but goes to the point, gives you the pertinent information that you need coming from a different specialty to do your job? Definitely the concise note is going to be preferable. And then there's the ever present issue of physician burnout. This is a big problem. And I think writing long documentation, not being concise, contributes to that because it hurts you in both ways, both ends. One, you're writing the long notes, so that's going to take more work, more time, and it's going to make you more likely to have physician burnout. Medical documentation is one of the main issues contributing to physician burnout. And then on the other hand, if you're having to read long notes from your fellow specialties, fellow colleagues, and that's also going to increase your likelihood of going into physician burnout. So why, if having long notes is such a big problem, why are so many physicians writing long notes? Well, I think it starts in our training. When we're in training, the main objective is to learn. And in that setting, writing long notes shows that you know your stuff, that you're sharing all your knowledge, that you're picking up all the important information, and it's actually rewarded to write long notes. And your supervising physicians are gonna want you to write long notes to make sure that you cover everything, that you're very thorough. And that's not the real world. Number two, with EMR, there's a lot of copy paste or carry forward of notes, and I love that. I do it all the time, and we feel guilty about doing it, but we shouldn't. And we don't want to reinvent the wheel every time we see the patient. So I think it makes a lot of sense to carry forward whatever a lot of the information from the prior note. But I think where we need to do a better job is to make sure that we're trimming that note and not letting it just grow out of proportion. For example, I like to have in the prior labs, but if they've been more than a few years old, a lot of the labs to me expire, and I like to eliminate them. And if I want to look at them, then I just go and look at a prior note. So you want to trim out things that get obsolete or expire, like basic labs. Now there's some special labs, like if I do, I'm a neurologist, so if I do myasthenia gravis antibodies, then they were positive 10 years ago, that's still relevant now. So I'll keep those in my note that they were positive in 2010, and that's still relevant. But other things that expire, I'll remove it. If I'm seeing a patient with MS and I do MRIs every year or every couple years, I don't need to keep the impression of every single MRI. I can, if I updated the MRIs, I can get rid of the old ones and just keep that latest one in my note for reference, so that the next time I see the patient, I can just look at that result. I don't have to go look at multiple notes to see what the last MRI showed. So things like that. Also, the interim history, things that have happened in between visits that you can eliminate from one visit to the next. You don't have to keep adding all that history. So maybe the initial presentation of the problem, you might want to keep it and maybe modify it or tweak it a little bit. And so it's making that extra effort of not just carrying forward and copy paste, but also reviewing what you have there and trim out things that are no longer relevant. So I think we need to do a better job of that, including myself. Sometimes with the rush, with time, I don't do the best job, but I try, make an effort to update my notes in that sense. But I still enjoy carrying forward information and using templates. Also, when you use templates, I think it's very important to really look at what you are the template and make sure that it makes sense and that you modify it to be relevant to your specific situation and patient. Okay. So other reasons why our lungs are becoming so long is reimbursement myths. We think that the longer they know, the more we can justify billing maybe a higher code, and that's really not true. You can have a short note that involves a lot of complexity, and you can still bill a higher code. So the complexity of the decision making, if you're making decisions about immunotherapy or switching therapy, that's pretty complex. As long as you document that, you don't have to have a super long note and to justify that higher code. And legal risk. Well, there's also a legal risk to uh, carrying forward and copy pasting and putting a lot of information that is incorrect or not relevant or no longer pertinent. And also, uh, the longer your note is, the more things that can be found wrong. So it's probably better to make it concise and have the information be accurate, pertinent, and up to date. That is much more valuable from a legal standpoint than having a 5-page note. If you have a 5-page note, there's many things the lawyers can find wrong with it, and that would uh, weaken your authority in a case in a court. So how does this impact patients, and how do patients impact our notes? And so in 2021, they passed the Open Notes Act initiative, which led to patients now have access to notes, whether they're in our outpatient setting or inpatient setting. So there's theories that may have led to more documentation and longer notes, but it could also uh, be a reason not to have such long notes. Because if you have a lot of notes with things that are wrong, irrelevant, that can cause more anxiety in your patients, and patients can find more things that are wrong because you're so verbose and including things that might be incorrect. And if the notes are very long, and patients are less likely to read them, which is not good. I actually want my patients to read my notes, and patients that read their notes are a lot more likely to follow recommendations. Also, uh, this is a topic for a separate YouTube video, but I really recommend that you collaborate with your patient when writing your notes. And most specialties are fit really well with this model. Also, now that notes are available for patients to read, that causes a lot of challenges and more work for patients, for physicians, because patients will read their notes and then they'll have questions, or there will be things that they don't understand or things that are wrong, and they'll call us at the office, and then we have to call them, and that's more work and leads to more physician burnout. So what's the solution? Solution is keep your notes concise. And think about it. When you're in the hospital, when you're on call, do you want to read your colleagues' 5-page note, or do you appreciate more when they write a very concise note that has everything that you need and all the important information without the fluff? That's what. That's something that you really appreciate, especially when you're very busy in the hospital. And I think that contributes to better patient safety and better outcomes. Because if you're more likely to read the note because it's concise and relevant, that means that you're going to grab all the important information. There's going to be better communication between you and other specialties, which translate into better patient care. So solution is also to edit your note. Look back at your note and trim out things that are unnecessary, no longer relevant, and that myself, I use the dictation software, and it often makes mistakes, so it makes, and I'm guilty of this, and sometimes I don't see those mistakes, but I try to make an effort, including myself in this, and to make sure that we're catching those errors made by the dictation software. And when you're running your note, highlight the things that are important. You can bold it, you can make it a separate bullet point, and that'll make it better for your patients to understand, and for other specialties, other physicians, to focus on the important information. So I hope this video is helpful. If you like content like this, and please click on the subscribe button. Okay, take care.